bottle is never full. There is definitely room to add more to what the conversation is about. How does it play in different arenas? And most importantly, the how. How do we move on from where we are right now? So this morning we have a panel of 4 brilliant ladies whom I have been privileged to work with in the past couple of years since we were all together at the Harvard Lead Fellowship as alumni fellows. We do have Preethi John, who's working at the University College of London. We have Beatrice Malewezi, who's working with Mothers to Mothers in Malawi. We also have Mareli Claassens, who's working with the University of Namibia. And finally, parliamentarian Julieta Kavetuna, who's with the Parliament of Namibia. So friends, please fasten your seatbelts. Let's listen here and be able to pick a few pieces here and there from the conversation that these 4 excellent ladies are going to share with us. Without any further ado, I want to call upon Preethi, who is going to kick us off with the decolonization conversation in public health management, basically the academic perspective of designing curriculum and so much more from the academia. Preethi, please take it on.
Thank you, Alice. Just give me a moment while I share my screen. All right. Thank you so much, Alice. And to take the important introduction that Alice kind of laid out, which Jim also alluded to, this is certainly not the very first time that we have come together to discuss about this important topic. And yet, if we think about this particular topic, we need to have so many different perspectives about this. And so I'm kickstarting with just one perspective, which is from the academic front. So moving on, I've been looking at the questions that has come flowing in, and I've just listed a few out here, which I'm hoping to answer this and several other questions along this, which is looking at what is, the conversation around decolonizing global health. And as the title of this webinar also is, it's not so much about explaining, but rather getting into action. So it's talking about what is currently happening, and from an academic perspective, what needs to happen is what my focus is going to be on. So I'm going to look at decolonization, whether it's from public health or global health, or from the area of healthcare management, which is the area that I work in, and trying to make sense of what conversations happen in this area in India, which is the country I come from, but also in UK, where I am currently working. So I'm going to look at, some of what is happening now, and some thoughts about where is the direction that this needs to move to, and finally concluding with a call to action. But before I get into that, I also would like to take a few moments to get your perspective on your thoughts. So if you could kindly either go to the code which is listed above, or scan this QR code, you should be able to answer this question. Could you give it a try, please? So this current question is, what is that single source you feel you learned about decolonization? So I'm just going to give it a minute and then move on. I have a couple of questions, so if we could just look at it, and then I'd like to continue with my topic. All right, so I've got one more question. I'm going to shift to that. If some of you are still answering this, please go ahead. It's interesting that the other, and I'm curious, what is the other? So perhaps that could be written in chat as well. What do you mean by other? I was thinking that it might be articles or university education when I had applied the same thing a few months back with another cohort. So this is interesting to see that there is other ways that we are learning about this topic. All right, so what are three terms that comes to your mind when you hear about decolonization? If you could, again, scan the code or enter the code on the top, and then just three terms that come to the top of your mind when you hear about decolonization. Well, I think this is really interesting because, as you can see, the terms like equity, power, change, respect, which come in a bigger font, it means that majority of you have probably written that particular term, and hence it kind of comes out. But there is a whole set of other words as well, which kind of, when we think about what is this concept and what is the key terms that we are discussing about, it's precisely this, what we see in this word cloud. Decolonization, or any action towards it, is to advance. And in this particular case, we are talking about health equity. It is also about changing the power dynamics. And, I will speak about this later. Actually, it's one of the points I had in my call to action, that when we are talking about decolonization, we're not just talking about some changes, but we are seeing whether that change is really changing the equation of power, with therefore the ability to influence, the ability to be represented around the decision-making table, and therefore advance or accelerate equity. But it's also about justice, respect. It's also about the term, I see this term reparation, and that's another term when we read articles about decolonization, we hear a lot of this particular term. So I'm not reading out every single term out here, but I think you as the audience is already spot on about the different dimensions of this discussion on this topic. And I want you to now think about one last point, which is, this wonderful seminar, and thank you so much for organizing this. It's, I was actually very, intrigued by the title itself, because it ends with a call to action. So it's, if we are already listening and learning about decolonization. We're kind of seeing the different perspectives of what is decolonization. Then it's also important to think about what is it we are seeing, perhaps in our local area, as perhaps it's a best practice. Perhaps it's a call to action that you want to make to the rest of us here. So the final question is, what is your call to action, before I just share my part from the academic perspective? So what do you think in this broad realm of decolonization, and we are talking about this change, what do you think needs to happen? What is that one priority or key area that you think needs to change? What is your thought? How do we bring about change? So there is a set of values. So that's why we see words like respect, equity. You know, who is at the center of this discussion, or who is actually the center of making the change? Are the key people being the voice of bringing about this decolonization? Funding commitment, absolutely. And I think one of my colleagues will be talking about it when they go into research. So this is something we will be going into. Lawmakers, yes. I think this is, you know, we just can't get away. We're going to talk about change. We're going to talk about power. We're certainly talking about politics, which means that we need also political change, political willpower. We also need in healthcare, what kind of health policy changes needs to happen. And of course, a whole lot of open and honest discussions. All right, so I'm just showing one important article among several which are out there, but I kind of am showing this because my framework of this particular discussion is around the academic. So decolonization and what is happening at the university. This particular author, who is writing it from the perspective of being in a UK university, but kind of scans the environment and kind of talks about what is this decolonization? What are we trying to do? And how should this discussion be? Is it only about talking about something that has happened in the past? How do we talk about this in terms of moving towards the future? And some of these points are very, very interesting. And I've used this in this particular presentation that I have made. So I kind of look at decolonization kind of perhaps on a spectrum, from at one point a colonization which occurred, and therefore this whole debate about the need for decolonization. But there is also this terminology that I see coming up, which is about recolonization, which is, you know, new forms of colonization. So how does this decolonization address not just perspectives or structures or inequities that got created in the past, but perhaps are getting created now, even in the realm of academic environment, and therefore recolonization is happening. So the decolonization is not just addressing the colonization, which is in the past, but it is equally important to acknowledge newer shapes, which is happening in the present, and therefore the decolonization for the future. So when we look at the terminologies that are in this, we can see about indigenous, localization. We also see the kind of color or the perspective that the word like tribal, native, indigenous has. What does glocal mean? So I think all of this and how it's defined, how it's portrayed matters in this debate about decolonization. So in academic perspective, it's, where are we learning about decolonization? Is it there in our curriculum, medical curriculum, nursing curriculum, healthcare management, the allied health? When we look at it, is there any program? Is it just an elective? Is it a topic which is fitted in somewhere? So that's one area of research. The other is who's teaching about decolonization and who framed that curriculum and who is this target audience. For example, I feel there are far less conversations in India on this topic than in other places. So is there more conversations on this topic, let's say in Europe or UK or in the West, rather than, let's say, in Southeast Asia? And again, when we come to whether it's learning methods or when we talk about assessment, if an essay is written and the perspective of, let's say, the tribal, the indigenous population is presented, what is the kind of perspective that is put forth and what is considered right or what is considered as from literature? How does that framework take it forward? So these are kind of important thoughts that we need to bear in mind when we are talking about decolonization from an academic perspective. And this particular article, it had this very interesting perspective of that when we are talking about decolonization, it's not just about studying, let's say, in Africa or in Southeast Asia or Latin America or something. It is also about understanding where we are. What is the kind of inequities that happen? So it's not about going to, a place where there is poverty or a lot more ill health to study that, but studying it in different countries where are marginalized populations, and how do we show it as allyship rather than just looking at everything is fine in this country, the problem is there in that country. So when we are studying about decolonization, it's recognizing that every region is affected by it and to think through what is the action required. Which kind of brings to my final thoughts on this, which is call to action would be in which curriculum can we incorporate this important topic? Because if there isn't awareness or sensitization at all levels, do we just include it at doctoral masters, or should it be there in school curriculums as well? And, a lot of times decolonization means it's translated to as representation in certain, perhaps, things. For example, in academics is who is teaching? But we are not talking about the count. We are talking about the influence and power dynamics, whether that has shifted. And so who is designing the curriculum around decolonization? Who is teaching? Are all people getting, in one sense, taught or sensitized to this topic? And we need training of trainers on this. How does that happen? Is it just by doing research on this, or it is lived experiences that enables part of this to be taught? And we need a lot more partnership to be in place. For example, how does the media react when this call to action goes out? Can we get media as a partner to be sensitized so that they also are able to construct the dialogue in the way it should be? And we look at stakeholders. We need to understand the stakeholders are beyond the realm of academics. It is all the stakeholders that can make health equity a reality in this strive for decolonization. And with that, I'm going to hand it back to Alice, and we will perhaps continue the discussion through the questions, through the chat, and at the end. Thank you.
Thank you so much, Preethi, for sharing these very, very good insights with us. The decolonization conversation from an academic point of view, where you have been highlighting, what does decolonization mean, or what is the conversation about in public health management, focusing on the academic perspective. And for those who just joined us, Preethi has just spoken. She's our first panelist. Preethi is the Associate Director the Associate Professor with the Global Business School for Health at the University College in London. Preethi, once again, thank you so much. And I just, when you were sharing some of these insights, I listened in very, very attentively. And when you point out issues to do with allies, what is it that we must be able to take forward from here? What does decolonization look like? And what do we need to do as warriors in this conversation? When you talk about allies, talking about the media and how we can sensitize the media to be able to construct this conversation and put it out as much as possible. These are areas that I would definitely would want many of us to take on moving forward from this conversation, but also building or adding a brick to the entire conversation. Preethi, just one very quick question before I move on to our next panelist, Bridget. It's, in your view, with the issues that you have highlighted as the next course of action, those that should be our next course of action, what then do you feel should, the terrain look like once we say that we have now decolonized global public health?
I think, it's a very interesting question, because I think what will happen if we address this properly is the questions are going to change from addressing just of what is in the past, but really recognizing the newer, subtle ways in which we need to address decolonization today. So what is those issues right now happening, which perhaps we are, not on the top, but it is taking us away from inequity. There is AI technology coming in a big way, and it is looked at as a good way to counter or to facilitate decolonization. And yet at the same time, we know if AI, artificial intelligence in healthcare is not applied properly, then bias can be, in one sense, worsened. So to my mind, it is, that's the direction. How does technology perhaps, affect or shape this discussion on decolonization? Thank you.
Great. Thank you so much, Preethi. And I know that several of us do have questions. I will just pause here for now. Those who have questions, please feel free to share in the Q&A box. As towards the end, you'll also have an opportunity to ask your questions. Some questions have been coming in, and we will have an opportunity to respond to some of those, but not all of them. There are so many, but nevertheless, the conversation, will be continuing. So next on my list of panelists is Dr. Bridget Malewezi, who is the country director of Mothers to Mothers in Malawi. Bridget will be talking to us about how colonization is actually impacting the implementation of programs. And she's going to zero in on, women's interventions. What does that look like? I'm so excited to hear more about what Bridget is presenting, in addition to what Preethi has already presented. So Bridget, over to you.
Thanks, Alice. And good morning, good afternoon to everyone. Please give me a moment to share my screen as well. I hope that you can see my screen. I'm trying to get to the slides now.
Yes, you can see it. Yeah,
Trying to
you
get
can
to the
turn
slideshow.
into slide mode.
Yeah,
Mhm.
try to move that. Technology always has its way of not working on the day. So as Alice shared, I'll be walking you through the impact of colonization on public health and women, the impact on women as well, while I try and figure out how to get to the slideshow. It's somehow it's been covered for by the panel of the panel of this of the webinar. I'm not quite sure. Trying to see from memory how to get through to all the different sections. Sorry. Apologies for this technical glitch.
It's down at the bottom right corner.
Yeah.
There you go.
Thanks, got it. Thank you so much. Thank you. Yeah, and then so I'll be going through as the presentation was about how did we get here. I'll go through the impact of colonial legacies and how the impact of those has enduring effects on health, and also how it has impacted on health in terms of ended up in health disparities and how to address those disparities, as well as a call to action to address those specific disparities as well. So we're probably all aware that colonial systems were based on systematic domination and exploitation of territories and peoples by foreign powers. And throughout history, as we will continue to discuss today, colonialism has been characterized by the imposition of foreign governance and economic structures and cultural norms onto indigenous societies. And it's interesting to mention the word indigenous. I saw that Preethi mentioned some of the terminologies that we use today. And I saw that indigenous was one of the terminologies that she had highlighted as well. So to look at the colonial impact on societies based on that historical context of the domination and exploitation of peoples by foreign powers, when we're looking at one of the key aspects that we wanted to address, how these has impacted on societies. One of the aspects that we wanted to highlight as well was how migrant labor impacted and how it had an effect on family structure destabilization. Migrant labor forcibly separated individuals from their families, and usually for economic exploitation, and disrupted traditional family structures through a widespread implementation of these migrant labor systems. This disruption led to destabilization of family bonds and communal support networks as generations were separated and left to navigate socioeconomic challenges independently. This has had a long-lasting effect, and many of these policies still affect societies today, making life harder for groups who are already struggling with social problems and economic issues. As an example, as mentioned, I'm based in Malawi. Malawi is in sub-Saharan Africa, and historically was part of what was known as the Federation of Nyasaland and Rhodesia. And in our history, Nyasaland was seen as was not mineral rich. At that particular time, it was seen as not being mineral rich, although many mineral deposits have been discovered recently. So because of that particular identification of Nyasaland, what was Malawi then? Malawi was basically seen as an exporter of migrant labor, and this is something that has continued to today. Many of our young men at that time were migrating to either Rhodesia, which was Zimbabwe, or South Africa as well, and to the mines. And this, as I mentioned, this had an impact on the family structure and the support systems that were available to women and their families as well, because most of the times the man would be away for many years in another country, and this often affected how the community was able to to survive. And this has persisted still quite significantly still, because of many areas in Malawi still have quite significant migrant populations still moving towards surrounding countries as well. And another impact of colonial structures was also the reinforcement of patriarchal systems. We cannot deny that most African societies, even on this day, have never been really matriarchal or even equitable. However, colonialism also reinforced patriarchal systems in societies by promoting male dominance and authority structures, often at the expense of women's rights and autonomy. This perpetuation of gender inequality limited opportunities for women's participation in decision-making and contributed to disparities in education, health, and economic representation. The enduring effects of colonial-era patriarchal norms continues to shape societal dynamics, hindering efforts towards gender equity and inclusivity. And then also another aspect of colonial legacies is something to explore, is the impact of Western religion and practices on health, and how those impacted on traditional religion as well, and the practices of health. And colonial powers shaped health systems in their colonies to serve their interests, resulting often in loss of cultural heritage, health inequities, and limited access to healthcare. In terms of cultural heritage, this disregard for indigenous health traditions eroded cultural identity and knowledge systems that have been passed down through generations. This loss of cultural heritage undermined community cohesion and resilience, as traditional healing practices are often deeply intertwined with broader cultural, spiritual, and social frameworks. And when we're looking about health inequities, it's something important to also think about. Western medical practices do not always align with the cultural beliefs and experience preferences of the marginalized communities, leading to mistrust and reluctance to access healthcare services. This is something that we've seen also persist till this day as well in many countries as well, colonized countries as well. And then often, finally, about the access to healthcare, the dominance of Western medical practices resulted in limited access to care, particularly in remote or rural areas where Western healthcare facilities may have been scarce or inaccessible. And this is something that we will see in terms of how this has persisted till today in many of the health systems. The enduring impact of colonialism on health systems is reflected in the persistent health challenges that continue to happen and disproportionately affect marginalized populations. And most significantly, what we often see is the urban and rural divide. And colonial legacies have perpetuated stark disparities in healthcare access and outcomes between urban and rural areas. And colonizers often concentrated resources and infrastructure in urban centers where they resided, leading to more advanced health facilities and services, and limited healthcare services to other communities. And this exacerbated health inequities. And this is something important, especially for myself as well. As mentioned, I'm based in Malawi, and our population is about 20 million, and 84% of our population is actually based in the rural areas. And that's something we've seen, that 65% of our population lives within 5 kilometers of a health facility. That means just under half of our population lives more than 5 kilometers away from a health facility. And the rural-urban divide, which has persisted over time, means that many of the rural populations continue to face barriers such as long distances to healthcare facilities, inadequate infrastructure, and shortages of healthcare professionals in their settings. This is something that is, as I said, it's persisting. It was created through the colonial structures that were invented that time, and then these have persisted over time. And then also, from a global perspective, we're seeing persistent global disparities between the global north and the global south, and which is evident in health outcomes. with African countries experiencing significantly higher maternal mortality rates compared to the European counterparts. For example, in Malawi, we used to have a maternal mortality ratio of about 1,180 about 10 years ago. And this has come down to about 450, but you can imagine many of the global north countries have maternal mortality is below 50. So this is something that's something, a stark reality of the persistent influence of colonial influence on health systems and what's happening globally. And this reflects the historic inequalities, including limited access to quality maternal health care, inadequate infrastructure, and socioeconomic disparities as well. Similarly, the gendered nature of adolescent HIV infections underscores the intersectionality of health disparities, with young women in Africa facing disproportionately higher rates of HIV transmission due to factors such as gender-based violence, limited access to education, and economic dependence. So we've gone through the context and the background of how we ended up where we are, and we're looking at how do we address these health disparities. One of the important factors we need to be looking at how to empower women for health, and we can also be transforming their lives through peer mentorship and health education, enabling women to be agents of change in their own communities. And it's important to be leveraging off-proven models for improved health outcomes. So, for example, at Mothers to Mothers, we focus on peer mentorship, health education, and support for women. Empowering women. Our model mainly is focused on empowering women living with HIV to become mentor mothers. We're giving women space to transform into leaders in their communities. And this is an important aspect because when we invest in African women, we're going to be able to try address some of these challenges, especially in the African health challenges. Women are often the primary caregivers and the key decision makers in healthcare seeking behaviors within their families, support, and communities. And when we empower African women with adequate training, resources, supportive supervision, and leadership opportunities, we're able to improve health outcomes, promote preventive care, and build resistant healthcare systems for the benefit of entire communities. And one of the other areas where we're really focused on is advocate for recognizing the role of female community health workers, and that they should be paid. Often in many programs, many women end up.
These research products may also culminate in scientific publications, but the work of our Claassens is specified the way in which authorship.
Bridget, are you there?
At our organization.
Bridget? Jim, can you hear me?
Yes, Alice, it looks like Bridget has frozen, so we may need to, if she can't come back, we may need to go forward.
Sorry about that. So Bridget has frozen just before concluding her presentation, but I know that we will be able to move on, we'll be able to discuss it further during our Q&A session. But, and I do appreciate the fact that Bridget has been highlighting the real impact of colonization on women's health. I'm sure many of us will be able to appreciate the fact that women are part of that marginalized group that has actually been hugely affected by colonization of global health. I would want to move on to Mareli Claassens, who is the Associate Professor of Research at the School of Medicine, University of Namibia. Mareli is going to speak to us about decolonization, basically the decolonization perspective, following on to what Preethi did present to us. This is again in line with academia, and Mareli will zoom in on research, but more so research and funding, related to research. So Mareli, I'll hand over to you.
Thanks, Alice. I'm just sharing my screen, and I hope you can see the right version of my screen. So good morning. And let me just remove that as well. Okay. Good morning, good afternoon, good evening, everybody. I'm so happy to be here with my colleagues and friends. I'm going to start with a quote by Jean-Jacques Rousseau, who is the French Revolution stalwart and philosopher. And he said that freedom is the power to choose our chains. Now, for me, I would like to see a world where freedom is the power to choose freely. But I guess we will discuss the types of chains we face as academic researchers in our world today, for now, until our world is truly free. So I'm going to use the example of the COVID-19 pandemic, since it's fresh in our minds, and almost everybody is an expert, right? So everyone remembers the pandemic quite well, and we all have our own experiences and experienced traumas and losses. I would like to highlight a few issues around the status quo, in other words, the way in which I experienced academic research during the pandemic, as examples of places where we can deliberately make our voices heard and shift paradigms to ensure decolonization in academic research. For instance, let's start with the challenge of distributive justice. So how do we ensure that what we have as scientists and academia reach everyone in a just way? Just to refresh memories, justice is a step up from equity, which means in a just way indicates that someone is standing on a box and the wall is removed. I'm, of course, referring to the pictograms of people of different sizes trying to see over a fence. So during the pandemic, we had excellent vaccines developed by the best minds in the world, and it was very quickly done and very efficiently. We also had an organization called COVAX working on the fair distribution of vaccines. In effect, we did not receive the same vaccines all over the world. Some places never received mRNA vaccines, some very few, some only much later in the pandemic. So as academia, how do we make sure that we decolonize? How do we make sure that what we develop and what we find and what we make sense of gets all across the world and get used all across the world by those most vulnerable specifically? So I would say by advocating that our findings are distributed across the world in a just way. And that means that it's unfortunately not just about advocating, right? It might also mean that as a scientist, I must change my contract with a funder or distributor of consumables to reflect my moral position and to say that if I develop an mRNA vaccine, I want it to be used by the poorest of the poor. And that's just an example. So secondly, how could decolonization reflect in academic freedom? For instance, in conference attendance, or in who gets to study at the most prestigious universities. During the pandemic, because people living in the global south, and I know that I'm using a term which is not always liked, but I'm using it for a lack of a better term, did not have access to very specific vaccines, myself included, we could not travel to conferences, right? So someone who was not vaccinated with either the Moderna vaccine or the Pfizer vaccine couldn't travel internationally if you're coming from the global south or a lower middle income country. Our counterparts from the global north, however, with the so-called right vaccine could travel everywhere they wanted. This injustice was on top of the huge challenge that people in the global south already experience always to get visas in the first place, to travel anywhere at any point in time. So we were disadvantaged from a vaccine and a visa perspective, and there was very little to do about it. So what can we do about it now? So first comes awareness, and I'm hoping by the end of this talk, everyone would be aware of these issues in academic research. And then comes spreading the message, talking to people about it, talking about it in academic research and at conferences. And if you get the chance to travel, spreading the message. And then comes action through organizing. How can we organize? How can we make a group? How can we latch onto an already existing group? How can we boycott certain organizations when they don't follow these kinds of guidelines? The same unwritten rule apparently goes for invitees to present at academic conferences as well. So most recently, I've been on the organizing committee for such a conference, where one of the keynote speakers who were invited comes from a funding agency. And when I looked at the funding streams of this specific agency, they only fund individuals from the US or from Canada. And that's while the conference is specifically geared and focused towards getting an even sample of attendees from the global north and the global south. But if we only have funders at such a conference who would fund someone from the States or Canada, my chances coming from the global south, from a lower middle income country, is zero. It seems like a no-brainer, right? So we have to have people attending the conference who can fund anybody at the conference, but it doesn't happen. And when I mentioned it, my comment was largely ignored. So what can I do next? And that's the key question. Should I comment again? Should I comment louder? Should I suggest an alternative? And this same principle also speaks to who gets funding to do research. So I reflected on one of the questions posted in advance, which specifically addressed PEPFAR and whether PEPFAR should be discontinued. And I think we cannot really argue the fact that PEPFAR has meant a lot for people living with HIV all across the world. And it has made huge differences and shifts and in paradigms and ways that we've been thinking, in the ways that people with HIV are treated. But we also have to be aware, and we have to be very honest with one another, that funding organizations many times, not always, but many times also benefit the individuals from the places where the funds are coming from, right? So Americans also benefit through the CDC and PEPFAR, and mostly these individuals who benefit when they're from the States are not people living with HIV. Now, again, I'm not generalizing. I'm saying most of the time they're not people living with HIV. So I think we need to ensure fair benefits where it's needed the most. And secondly, with regards to funding, how do we make sure that the funding is distributed justly as well? I remember distinctly during the pandemic when I wrote an application to a European funding agency, and the project was about the interaction between tuberculosis, HIV, and COVID-19. The prerequisite for funding was that the PI should be in Europe, although the work would be conducted in Namibia and Botswana. And that brings me to the next point on who does the dirty work. We also need to recognize that most field and ground workers in healthcare and in healthcare research are women, and most leadership positions are filled by men. And I think that has been addressed by Bridget in a sense as well. Coming back to the Global South, when finally, at some stages, and it's happening more and more often, we do make a breakthrough. For instance, when Omicron was recognized and sequenced by the South African and Botswanan scientists, we, from the Global South and from Sub-Saharan Africa, hoped for respect, and we got another travel ban, although the number of cases in Southern Africa at the time were much lower than in Europe. At the time, I wrote an op-ed for Think Global Health, and very little was said about it. It was specifically about the scramble from Africa. All of a sudden, people just want to leave Africa and not come back because of this new variant. And it was counterintuitive because the numbers were not speaking the same message. So again, what else to do? Write again or scream louder? Finally, I want to say a few words about authorship. I teach my students very specifically to be adamant when they work on an analysis or a scientific paper. They have to negotiate beforehand to be a first author, and there's no compromise. And similarly, someone from the country where the work is conducted has to be a senior author. Again, no compromise. Obviously, this depends on the scientific contribution. I mean, if you don't contribute to a paper, you can't be first or last author. But we can only move forward and upward if we are respected and treated as absolute equals. I reflected on another question which was posted in advance, which asked, what is decolonization in a few words? And for me, it's the removal of power imbalances, or at least to start with, the recognition of power imbalances and how it impacts on the most vulnerable. I'm finishing with a quote by Desmond Tutu, who said, if you are neutral in situations of injustice, you have chosen the side of the oppressor. My challenge to us all is to choose a side and to work on actionable points to remove power imbalances in academic research and in all other aspects of global health. I've named a few action points. Some I've tried, some were more successful than others. We all have to take up that challenge and tweak it according to each of our own circumstances. And we can never surrender. So good luck.
Thank you so much, Mareli. Indeed, we can never surrender. And I do like, your phrase on the fact that we need to recognize, but also remove any power imbalances if we are thinking about decolonization. I see we are fast running out of time. I want to hand over very quickly to Honorable Julieta Kavetuna, who is a parliamentarian with the Namibian Parliament. And Julieta is also a public mental health specialist. She's also an outgoing deputy minister in Namibia. Julieta, I hate to say that I'm going to reduce your time by just a little bit of minutes so that we can have a discussion right at the end. Over to you, Julieta.
Yeah, thank you very much. Thank you for giving me this opportunity. And the discussions that we have been going ahead.
Julieta, your connection is not, it's cutting out.
Decolonizing global health is a political issue. When we say it's a political issue, it's because there is a very close link between the issues regarding public health or global health and other related issues that people are discussing at platforms that need to be discussed, like maybe when you go to the international, the UN forums, they always discuss about health as an annexure, but not as a substantive thing. And that makes it a little bit also promoting the inequity that have been within this. Okay, can you go to the next slide, please? Yeah, so then the issue of decolonizing health, it cannot be discussed if we do not go back to the history and also looking at how we were colonized as the global South. I think it's a better way to discuss, but to mention it's a global health, it's a global South, but that is actually the bone of contentions, because the space in which we are moving, it's of a certain characteristics that come to put the competition of or the contest between political financing, political interventions, political others plus the well-being and accessibility of health of people. So when I look at the whole funding system, there is so much inequity. When you look at the per capita of the United States of America, health spending is $12,000. But then you come to a country like South Sudan, the DRC, the average thereof is $21,000. It's $21. One will wonder what is it that we cannot do? What should we be prioritizing with the $21 while the other people with their money correctly, with their money, are doing so much with a 12,000. So that disparity already, it's a question that need to be addressed. And it's such a huge disparity. So the African, I'm speaking from the African perspective, though the representation is from the global South, have tried to sit at various events, and one of them, which is very significant, is the Abuja Declaration, where they said that how much the countries spend on health, and everybody in that meeting have decided that we spend 15%. A good healthcare system will be when everybody spends 15% of your budget on health. Up to now, there is countries that are still at 4%, but we are moving forward and we are saying that we are doing what we're supposed to do to health. Where does the money come from? Namibia, South Africa, Botswana, our budget represents 60%. The funding in health, more than 60%, it's our domestic finance. But what about the other countries that do not have those resources? But what is very paradoxical is that the funders are coming and tell you what you have to do with the money that they are giving you, who you have to employ. So the whole gains that you have put in your healthcare system in order for you to prioritize what is very important in your country is being reversed because somebody else thinks that the money that is giving should have a name of a disease that's supposed to be eliminated or whatever. So the whole gains for the childhood diseases like polio that we have gained in 20, 30 years, it's actually been reversed because the children are getting polio now because we do not have the funds. And the funds that we are getting in the name of aid, it's very limited and also being prescribed for what it's supposed to do. So how to act, and the action is very, very important. And I think that how to act impactful, we should change the paradigm shift. We should move away from the way things are being done. Knowledge shift is also very important because when I was reading the comments and the discussion about decolonizing health, it's been held by the people that are colonizing. So there is no discussion about the issue of decolonization in Africa. I was a deputy minister, as I have been attending so many meetings, but there is no discussion. We are still talking about the old little things. While the discussions of platforms have been created, journals have been written about decolonizing health, who is leading the whole thing of decolonization of health? So that leadership shift is what is very important. Let the Northern Hemisphere not be the one who is talking about decolonizing, because they might not even understand what it means in real terms of the world. But also the Southern Hemisphere must not sit and wait until to be told that there is this concept that we need to discuss. They should be able to come up, and I know many of our leaders in the South knows exactly what decolonizing or decolonizing mean. So they should start leading that discussions and put it ahead. You can actually eliminate coloniality by being the person and being the front runner in your discussion. And reduce systematic inequalities that we have even in among ourselves. Like, for instance, when I'm saying 21 per capita, Namibia is standing at 1,000 something. So it's not just the whole thing. And it's the question of the sub-Saharan Africa that have also been roaming around here, that we are just clustered all together. I think that it's very high time that we also have to break it down to the lowest and assist the vulnerables in order for them to come to a certain level. The equity that Mareli spoke about, it is very important. And create new knowledge. People should start knowing that what is it that we want as leaders in our countries? What is it that we need to advocate? When is the UN going to talk about decolonizing health? And when are we going to be the front runners of this thing? So global health, the global health we want, it is the end goal of decolonization is more equitable, inclusive, and just approaches to address the global challenges, where community and nations of indigenous people and the global south have control and ownership over their own health research products and agendas. So that's the global health that we want, where that disparities is already taken out, where we use our indigenous knowledge to heal and spend save money on unnecessary vaccines and others, because there is indigenous knowledge, and if it's research and taken the highest stage of the top stage, it can help us to eradicate many diseases, and we can actually go ahead and deal with our issues. The last slides, please. The responses to the questions. The question of sub-Saharan Africa, it's a very political one. It's a very dynamic one. And I think it needs to be processed and be led by people. We can call upon it and say that, what is sub-Sahara? It's just, so it have been described as a location, but ultimately it became a name that it's wearing and carrying a stigma among us as Africans and people of Africa. We have such a beautiful continent that is called Africa, and Africa is diverse. Africa, it's a continent that that have the potential, with the most young people, with the most resources. So that concept of trying to cluster a whole continent of 54 countries in one description, I don't think that it's correct, and it needs to be discussed at the different levels. How will we achieve decolonizing the global health when we still dependency? That's a question that I just addressed, that we should be the leaders of our own change. One change, we should be the leaders. So I think I will end here, as my moderator have given me a very few minutes, but I think I'm satisfied with what I have presented for the time being. I thank you very much, Alice, and every listener.
Thank you. Thank you so much, Honorable Julieta. And unfortunately, I see we are running out of time. We have just a few minutes to the end of this webinar. Fortunately, the chat room is very lively, and I like what I have been seeing and reading. We'll quickly get into the question and answer session. We'll have just a few questions, perhaps, one question per panelist, and then we will be wrapping up. And so I have seen one of the questions that we have, you have responded to, Mareli, and just to request you to maybe, say this loudly once again with regard to capitalism. Where does it fit into all of this, and why aren't we talking about capitalism? Just under a minute, Mareli. Thank you.
I think people like money. That's what I put in the chat as well. And that's something that's internal to all of us as human beings, if we're honest. But we really have to start thinking about discussing with our children and with our students about a paradigm shift towards making values important and more important than money. So I know it's very ideological, and I'm not sure how we will do that in practice. But for me, if one starts to treat others with respect, with tolerance, with integrity, and you move away from the value that's being put on money as such, but towards a model where that same value is towards humanity and the values that I've already listed, for me, that's already a shift in the right direction. But we're not going to solve that problem here today. And I think Julieta has mentioned capitalism as well. It's a huge issue. It's always a huge issue because people like money, but let's move it into another direction.
Wonderful. Thank you so much, Mareli. And just a follow-on question on that. This will go to either of the panelists, Julieta, Preethi, or Bridget, and this is with regard to the LGBTQ communities. You know, how should we ensure that the LGBTQ communities are not being harmed by those who are actually, you know, part of the conversation on decolonizing global health? Does anyone want to go in for that? Bridget, are you putting up your hand, or is it? Okay, I do not see, so it looks like this is an area that we haven't tapped into, and we have to, you know, think about it. So that's a brilliant question that we need to think about moving forward, and perhaps, you know, this should be part of the discussion, you know, continuing from this webinar. I will move on to the next question, which is, how do we address tokenizing in the process of decolonization? I know Mareli has spoken to this to an extent, but just wondering, Julieta, Preethi, and Bridget, do you have any additions to this? Because there's a lot of tokenism. Some organizations have guidelines to combat some of the inequities in research, programming. Yeah, how do we address the issue of tokenism? Maybe we will, oh, sorry. Yes, Bridget.
Go ahead. I was going to say that, like you said, that Mareli probably addressed this a little bit, and it's part of decolonizing is making sure that those who have been affected most by the colonial structures have a strong voice, a clear voice, and are able to participate and make decisions for themselves about the things that are affecting them. It also relates to what Julieta was presenting about as well. And I think when we're having these discussions or key decisions to be made, it's important that those who are most affected by them should have a clear platform, a structure that they're able to contribute through which they can do that. As mentioned, for ourselves, we're looking at it from a perspective of like women. Often it's women who are often affected by some of the structures as well. And it's important that decisions about their health and their families and communities, they should be actively involved, and they should come directly from them. It should not be top down. It should also be from those affected. So if I'm the African woman who's affected by this particular thing, I understand my context as well. I understand the things that are happening in my area, the problem that I have. As Julieta was mentioning as well, that sometimes the conversations might not necessarily often have us, those who are affected, be involved or be able to make the decisions. It's something that we would want those decisions to be made by us. Sometimes tokenism often means that just bringing Bridget to come and decorate the stage, and because then we show that we had an African woman available for the conference, etc. But that ideally that I should be involved in that decision making about the decisions, and my contribution should be valued and should be heard, as mentioned by Mareli about some of the contributions she was able to make, but sometimes was not listened to. So that's something that we want to be able to see. Thanks.
Great. Thank you so much, Bridget. And while we have just a few minutes to the end, I want to open up for any live question, at least 1 to 2, after which we will, wrap up this conversation. Does anyone have a question? Jim, if you can help me look at the participants, if anyone's hand is up. I'm trying to do that from my side too.
Sure, happy to help. And so reminder, if you want to ask a question, go to the reaction section and raise your hand so we can see. And if not, we might want to, Alice, just have each speaker give us their 1-minute takeaway. The one thing that you want us all to leave with after everything that's been said today, we could do that as time is ticking.
Right, thank you. So I guess we'll start with Preethi. 30 seconds of your one thing.
Thank you, Alice. I'm going to just take up this question, which is in Q&A, about prestigious academic institutions. Why are they only located in Global North as part of the takeaway? In ranking matters, and that's what decides what is a top university. So I think it's also about what are the metrics we are using for measuring. And so the metrics might favor a particular set of universities or a set of actions. So I think in decolonization, what we are trying to do is change the metrics. And we need to think about whether it be for academics or whether it's for in terms of action that we are taking, what is the new set of metrics so that can change this discourse. Thank you, Alice.
Thank you so much, Preethi. Bridget, I'll hand over to you for your last comments. 30 seconds to you too.
Thanks, Alice. As you're aware, I was not able to finalize my call to action. Technical glitches happened, mainly because as I was presenting that there's various persistent disparities that are continuing in global public health, and maybe and related to the discussion we had about ensuring that we provide leadership to those most affected by these disparities. I would like to call on the participants to be able to invest in local organizations and invest in women as well, particularly African women, because, like I said, it's important that those affected should be able to be at the forefront of the changes that we want to see. So it's important for people to be able to find out what activities are happening, what organizations are doing, and local organizations are doing, and if they're able to support them in whatever way they can, whether financially or with the resources. I see Ruth mentioning youth too. Yes, the youth, not just women, but whoever is marginalized and most affected by these disparities, as I mentioned as well. And being able to support them. Some people are able to support with your time or your resources, your investments as well. And those are things that I would, was part of my presentation that I didn't get around to. Thanks.
Thank you so much, Bridget. And over to you, Mareli, for your 30 seconds of your takeaway point.
So I would like to take a step back and begin with myself and say, if I have respect for myself, I can also respect others. So let's start with ourselves. Then we move towards the others, which we know are all around us, but which are different from us, but which are all equal to us. And let's make sure that we focus on our shared humanity instead of othering the whole time. Let's focus on the things that really matter. Yeah, that's my 30 seconds.
Thank you. Thank you so much, Mareli. We will focus on the things that matter indeed. Julieta, 30 seconds for you too.
No, thank you very much, Alice, and all the panelists and the listeners, the people that joined the webinar. I really just want to, my take home is that we have a potential as a continent or the southern part of the world that we can change our own trajectory. And I'm requesting that our leaders, our workers within the healthcare facility, fraternity, should look at opportunities on how we can advance and expand our how we can expand our interventions, and also how to work together as a continent to make sure that we prioritize healthcare for all. And yeah, that's all what I wanted to share with the people.
Thank you. Thank you so much, ladies. And just before I hand over to Jim, I did see a question in the chat that I would like to respond to. That is the privilege of being a moderator. You can get to respond to 1 or 2 questions too. So this question is about how about colonization in advocacy? How can we actually decolonize advocacy in global health? And I think this is two-pronged. One is going back to one of the issues that Julieta and Mareli did touch on, decolonizing our minds first. Those of us who are in the marginalized or, you know, in the global south, I should say. One is, you know, we need to decolonize our minds and know who determines what the key priorities are, who then is going to lead a campaign that is going to reach out to different policymakers. Would it be, if I am Ugandan and there is a mega campaign on, for example, you know, access to medicines, who is going to lead this campaign? Am I going to leave a Ugandan take the lead, or am I going to leave to let someone from the global north actually take a lead? And if this person is from the global north, what exactly is their interest? I think we need to distinguish between having allies, but also having the key affected populations being at the forefront of the advocacy that is being you know, conducted. That for me is a major area to, you know, start to talk about decolonizing in advocacy. And on the other hand, from the high income countries or the privileged countries, what exactly is our interest when we are doing advocacy? And once we are clear on that interest, how then do we partner with colleagues in the global south to be able to take a campaign or an issue forward, rather than, you know, bypassing and taking the forefront of a given campaign or a given issue? First is to ensure that we are working with the communities and, you know, empowering or enhancing the capacity that communities do have in order for them to take the discussion forward. I know that I am shooting when it comes to advocacy. I would go on and on, but I want to stop here and hand back to you, Jim. Thanking you ladies, Julieta, Mareli, Preethi, and Bridget, for the great conversation, and to the panelists, to our audience. I know that this discussion doesn't end here. We will actually continue, and I know Jim will say much more about that. Thank you once again, and over to you, Jim.
Thank you so much, Alice. Alice, you did a beautiful job moderating this discussion. Many thanks to you. And again, thanks to all of our speakers, Preethi, Bridget, Mareli, and Julieta. Please give them some love in the chat or with reactions. We really appreciate you sharing your wealth of knowledge and your wisdom and your passion. And I will say, speaking as someone who considers himself to be an ally, I think all of us who consider ourselves to be allies really need to check ourselves on the regular and really do what you said, you know, be mindful of who we put forward, be mindful of where our priorities are and what allyship means. It does not mean taking the lead. It means doing what the leaders want you to do. And many times I think the people in the global north take the lead, we give the funding, and we run the show. And that is really problematic. And I think all of us who are in these positions need to check ourselves as much as possible all the time. So with that said, we are at time. I want to really thank again everyone for showing up, our over close to 400 people who registered for this webinar. The recording will be made available. You'll get an email in the next day or so. When that's available, you'll also get a copy of folks' slides. And we'll have a resource document with some URLs you can check out as well. I dropped in the chat the AVAC PX Pulse podcast that focused on decolonization. It was just released yesterday, so a great companion to this discussion. And to Alice and everyone's point, this is an ongoing bit of work. It will take a long time, as long as it takes, as it turns out, will be a long time. It may be our work forever and ever and ever to undo all the damages that colonization has done. So this is the long haul. This is not even a marathon, it's an ultra marathon. So strap up, we've got work to do, and I look forward to having more conversations just like this one. So I will now officially close the call. Thank you again, and good afternoon, good evening, good morning, wherever you may be. Be safe and decolonize. Ciao.
Ciao. Thank you, Jim.